Hi, my name is Pip. I'm an author. This is my book, The Hunted, which is the first book of the Phoenix series. I am also a physiotherapist. So in my day job, I spend a lot of time teaching physios how to improve their skills, but I also treat a lot of patients. And mostly I treat them for complex spinal issues, postnatal issues, pelvic floor problems. I see a lot of spinal stuff. So what I thought I would do is I would put together a video that gives writers a couple of ideas for ways that they could minimize neck and shoulder and back pain that comes as a result of sitting in front of a computer for a long time writing or hunching over a laptop, most probably not in the world's best position, curled up on your couch or in bed while you write your stories. So while I'm hoping that you're going to find these stretches very helpful and useful, there are a few things we need to go over first before we go outside. Number one, it shouldn't be painful to do any of these stretches. It shouldn't increase your pain while you are doing it or after. It shouldn't be painful for you to get in and out of the positions. You need to be able to move comfortably in and out of these positions before you even try doing them. Number two, you should only feel what I described, which is going to be a mild, comfortable stretch. It should not be severe. It should not be painful. You should not feel pins and needles, numbness, altered sensation, zaps of nerve pain down your arms or legs. You should not feel any pain. Number three, if you're already experiencing nerve pain in the arms or legs or pins and needles, numbness, altered sensation of any kind, you have significant difficulty moving, you have a loss of range of motion, then I really strongly suggest that you actually go and see your GP or your physiotherapist now. Number four, these stretches are designed for a general healthy population. They are not designed for a post-surgical population or after you've had a broken bone. If you have any concerns about whether it's appropriate for you to participate in any of these exercises, please consult your physiotherapist. And number five, if you experience any undesirable side effects after or during these exercises, you should stop doing them. If you find it uncomfortable to get into any of these positions, or it's painful to stretch, or you start feeling pins and needles, numbness, altered sensation, you should stop. Okay, so let's go outside and I'll show you a few variations and ways you can modify the stretches depending on what equipment you have at home. The most important part of doing neck stretches properly and feeling it where you're supposed to feel it is the setup. So to start with, you can sit on a chair or sit cross-legged, put your left hand under your bottom, and with this first stretch, you're going to take your right ear to your right shoulder. Put your right hand on top of your head and gently overpress to increase the stretch. You should feel this stretch down the left side of your neck. You can then repeat on the other side. You want to hold this stretch for 15 to 30 seconds, and it should be a comfortable, mild stretch. Common errors with this stretch are that people do not rotate their head to the side properly. They actually pop their chin up and start looking up at the ceiling. With this next stretch, you're still going to be sitting on your left hand. Turn towards your right shoulder like you're trying to look and see somebody beside you on your right side. Then use your right hand on top of your head to gently help your head flex down like you're trying to check and see if you've shaved your armpit. You should feel this a little bit further around the back of your neck compared to the last stretch. The most common error with this stretch is that people hunch while they do it. You still need to maintain good sitting posture. Again, you can hold this stretch for 15 to 30 seconds and it should be a comfortable stretch. The next stretch you should feel running down the back of your neck and sometimes in between your shoulders. You're going to sit up straight, gently pull your chin down towards your chest and hold for about 15 seconds. Again, the most common error with this one is poor sitting posture. This groin stretch is one of my favorites. We give this to people in the clinic all the time when they're struggling with back pain, knee pain, and hip pain. You can easily do this stretch using a table or a chair. In this case, I'm using decking rail. Whatever you lean on, it needs to be stable and safe to do so. Walk your legs backwards. Make sure your back is flat. Try and think about the bones that you sit on in your bottom and try and let them open wide so that you're relaxing your pelvic floor a little bit. If you do this with your bottom tucked under, you will not feel as strong a stretch. Make sure your feet are wider than hip distance. Keep your knees straight but not locked, and gently take your bottom off to one side. If I take my bottom off to the right, I should feel this in my left groin muscles or my left inner thigh muscles. A variation of this is to add a knee bend, and this just lets me stretch a different area of this muscle group. Common mistakes with this exercise is locking the knees back too far, which will often happen if your joints are extra bendy, if you're hypermobile. Rounding your back, tucking your bottom under, and not relaxing your pelvic floor will mean that you don't feel the stretch particularly strongly. Again, this should be a mild, comfortable stretch. Hold for 15 to 30 seconds and repeat on both sides, 2 to 3 times on each side. Lancelot is a great stretch for your hip flexors. It is an area where people often get tight when they've been sitting for long periods of time. It is really important to set this exercise up properly so you don't jam up your hips and you don't feel it in your lower back. You should only feel this stretch in the thigh that you're stretching, nowhere else. Get down on one knee like you're proposing to somebody. If you need to, you could put a towel underneath your knee that you're kneeling on to make it more comfortable. Your front knee should be bent to about 90 degrees, and your back leg, your knee should be directly underneath your hip. Do not push your hips forward. From here, all you need to do is a pelvic tuck, so you tuck your bottom underneath you without lunging forward. Simply tucking your pelvis under should bring the stretch into the thigh on the side you're kneeling on. So if I'm kneeling on my right knee, I should feel it in my right thigh. Common mistakes with this one are to drive forward as you tuck the pelvis under, so to lose the alignment between the hip and the knee on the leg you're kneeling on. When you do this, you jam up your hip and you increase the likelihood of you feeling back pain while doing this stretch. You should also be careful not to throw your upper body backwards, as that also increases the strain on the lower back. Hold for 20 to 30 seconds and repeat on each side twice. Mermaid is a favorite of mine. It's a great stretch to relieve lower back pain, mid back pain, shoulder issues, and it also relieves stress on the neck. You can do this one sitting in a chair or sitting cross-legged on the floor. It's important when you do this stretch to keep your bottom super glued to the floor. That means don't let your bottom lift off the floor as you do this stretch. It doesn't mean put super glue on the floor and then sit on it. If you have a roller, place your left hand on the roller, keep your left shoulder set back gently, and as you push the roller away, reach your right arm up and over and stretch long through the right side of your torso. You can then take deep breaths to get extra stretch between your rib cage. Without a roller, you just plant your left hand on the floor and do the stretch exactly the same way. It's a slightly less intense stretch without the roller because you don't lean quite as far. A variation on this is more focused on the lower back, so you can add rotation. So before you push the roller away, you've got to put your left hand on the roller, set your left shoulder, right arm up and over, then turn and rotate through the chest so that your chest is pointing down at the ground. Still keeping your bottom down on the floor, then push the roller away. I find this one is most effective when done with a roller. You could try using a ball at home, so a large soccer ball, and have both your hands on the soccer ball to push the ball away. Mermaid, I hold each side for 2 to 3 breaths. I usually do 4 to 5 on each side. The chest stretch on the roller is designed to help minimize stiffness in your upper back and also to stretch out your chest. The worse your posture is and the more hunched you are, the more likely you are to be extremely tight through the front of the chest and stiff in the back. My personal preference is to do this exercise on a roller. If you do not have a roller, you can use a long pool noodle as long as your body is fully supported on the noodle. You could also use a rolled up towel. I will show you the rolled up towel variation. The important thing to note is your body must be fully supported on the roller, the pool noodle, or the rolled up towel. You can see that the roller is running from my head to my bottom along the length of my spine. If you have osteoporosis, you should not do this stretch without consulting your physiotherapist or your doctor. Carefully sit on one end and slowly lower yourself down until you're comfortably lying on your roller, your noodle, or your rolled up towel. I'm fairly flexible, so I can go into what we call cactus pose, which is my arms bent up at 90 degrees and my elbows also bent, and I can still get my arms on the floor. For a lot of people, this is not possible. If it's uncomfortable, there's any pain, pins and needles, numbness, you need to move out of this position. You need to find a position with your arms, perhaps a little bit lower, or lying flat by your side, where you can lie comfortably with or without a stretch. If you go into a position where you feel a stretch, it should be tolerable, it should only be a mild to moderate stretch, and it should not have any pain, pins and needles, or numbness associated with it. I like to lie on my roller for a minute at a time, but if you've never done this before, I suggest starting with a smaller time period like 15 to 20 seconds and slowly working your way up to a minute. Don't fall asleep on the roller. I've heard of people doing this because it does feel really nice, but you'll feel really stiff when you get off the roller. Really commonly, if you're sitting for long periods of time, particularly if you sit poorly, you'll get tight in your glutes, and this will contribute towards hip and back pain in an enormous way. Tight glutes is a really common part of back pain and hip pain, so I'm going to show you a stretch and a release for them. If you have a spiky ball, what you can do is work the ball through your bottom cheek, looking for tight areas in the muscle. Don't roll on the bone. Do not roll on any bones. Stay in the fleshy buttock area. Sometimes this can be pretty tender if your glutes are really tight, but it still shouldn't send any zaps of pain down your leg or give you any altered sensation in any way. This should feel like a moderate massage. If you have two spiky balls, what you can do is lie down, bend your legs up, lift your bottom up, put one ball under each cheek, put your knees and feet together, and then gently roll your knees side to side. This will allow you to massage each cheek in an alternate way that's less strain on the wrists and a bit more comfortable. From here, it's a nice position to move into your glute stretch. So with my legs still bent up, I'm going to cross my left foot over so that my left ankle is resting on my right thigh. I'm then going to loop my hands around my right thigh and pull up. I should feel that stretch in my left buttock. I'm going to hold this for 15 to 30 seconds and then repeat on the other side. There is a sitting version of this stretch. It's the same setup position. So I'm sitting, I cross my left leg over, place my left ankle on my thigh, very gently hold my left knee in position so that it can't pop up towards me, but I don't push it down. I then lean forward with a straight back, and I should feel that in my left glute. I hold for 15 to 30 seconds, repeat on each side 2 to 3 times. Most common errors with this one are that people try and force the stretch when they don't have enough hip range. So if you're struggling to achieve this position, don't force it. With the sitting stretch, people often hunch forward so they won't feel as much stretch rather than keeping their back straight. And sometimes this stretch is just a difficult one for people to actually reach their leg. If this is the case, try and just stick with the spiky balls. If the spiky ball is too intense, you can use a tennis ball. But whatever ball you use, it should have a little bit of give. Cricket balls, softballs, golf balls are not appropriate for this exercise. Dart is a nice relaxing stretch that I like to finish with. You lie on the ground with your arms stretched overhead as long as this is comfortable to do so. I'm going to stretch my left leg and my right arm as long as I can, hold for 5 seconds, and keep alternating sides. And I do this for roughly 30 seconds to a minute. Again, it should be a comfortable, mild stretch, like your body is elongating. I hope this video has been helpful to some of you and that it helps you write more comfortably. Don't forget that if you feel anything other than what I've described in the stretches, then you should see your GP or your local physio. These stretches should be comfortable to do. Don't forget to check me out on social media. I'm on Twitter and Instagram @PipCoombs.